I'm not worried when I meet new people what their first impression is of my teeth. I don't have that fear now. I know they're listening to me, not looking at my teeth. My name is Michelle, and I'm from New Raymond, Colorado. I've always had a lot of dental problems. It started in childhood. I had most of my baby teeth pulled, although I don't really remember the reason why. I remember the experience quite well, and I developed a really big anxiety of dentists.
Michelle is not a big fan of dentists. She really doesn't like to go to the dentist. She has had multiple missing teeth, and some of the remaining teeth had significant problems.
Felt like nobody listened to me, and I wanted to find a dentist who really cared about me and about what I was saying and what I felt. I think the biggest barrier to start with was the understanding of what it would entail. You see that it's an option, but until you are really looking at it as an option, you don't look into what all it will involve. And not knowing what all my options were, once those were laid out for me and I could make an informed decision, those barriers were gone. It was kind of an easy decision at that point. I felt like I had some knowledge to make a decision on what was best for me.
We recommended she have a 2-phased surgery because she didn't meet the minimum requirements for an all-on-4 due to her severe bone loss.
Prior to coming here, I had my front teeth removed and wore a flipper. And with my career, I always felt like that affected my speech, and I wasn't happy with that. It also caused a lot of problems, not physical, but just emotional problems for me. So I was not happy. And then when I need additional dental work, it was like, I just need to find a solution that'll work for me. I don't want this anxiety of the dentist to keep growing. So it was time to make a decision on something that was lasting, long-term, and a good fit for my life.
So our first phase was to bone graft into her sinuses and bone graft along the front of her jaw to rebuild that foundation. Next, we came back and placed an upper all-on-4. Her lower was reconstructed by placing 3 implants in the lower jaw for individual crowns and keeping most of her remaining lower teeth. She was initially seen in March of that year. Because of the extensive reconstruction, it took a little longer to build up her foundation, but we had her teeth in by Christmas that year.
It wasn't like somebody just telling me, oh, you have to do this and this and this and this. It was like, well, this is how we do it. This is how we'll ensure your safety. This is how we'll ensure your pain management. They answered questions I didn't even know I had. And so I just felt a really good connection with them. It's probably still not my favorite thing, but I don't know if it's anyone's favorite thing to ever go to the dentist, but I really don't have any anxiety when I come to Reynolds.
When you see Michelle now, 3 years after she was initially seen, she looks younger and more vibrant than when she was initially seen. She's just a happy, smiley person, and it's lovely to see her.
The first time I saw my smile in the mirror, it was like, this is the most wonderful smile I've ever had. I can't imagine how to make it any better. And I've always been a person who will never smile with their mouth open. And it's like, I'm so happy I can smile. And yeah, I love to smile. And I'm not worried about it now.